So Joint Commission came and reviewed the Joint Academy and the Total Joint Program at Cleveland Regional Medical Center and awarded us their disease-specific certification for total shoulder replacement, total hip replacement, and total knee replacement. It's a pretty rigorous exam that they do, checking things from beginning to end. Patient comes in to the time they leave, and do we meet all the appropriate quality measures and best practices. We're proud to be the first hospital in North Carolina to achieve the certification from Joint Commission in all three. As far as we understand, only the 6th hospital in the country to have all 3 certifications.
It's great to be recognized for what we're already doing. JCAHO came in as an independent commission, evaluated what we're doing, looked at our processes from top to bottom, looked at evaluation, pre-surgical evaluation, anesthetic evaluation, looked at the facility, our nursing procedures and protocols, physical therapy, the medications that we select preoperatively, intraoperatively, and postoperatively, how we handle anesthesia using special techniques both regionally as well as general anesthesia to deliver the state-of-the-art and best care possible. And they were very, very pleased with our process. For me, that underscores and speaks to the amount of cooperation and coordination that we have in caring for the patient at all levels. It's not just surgeon-driven, although certainly we are the overseers of the process. From soup to nuts, from top to bottom, on all levels, been analyzed and coordinated to provide the best experience for the patient and the safest experience and the most effective.
The first thing is Joint Academy. I think the program is beyond compare in any of the hospitals I've ever worked at, from residency, actually from medical school all the way through to this point. And that's really brought us all together kind of with a common goal. And I think the core group of orthopedic surgeons here in Shelby just, are interested in taking care of the patients. And I think that's the key. And then when you have someone bringing us together for a common goal, it really helps.
The Joint Academy is a place where people are geared towards treating patients with joint replacement. So everyone who's up there, they're all about the joint replacement. They know how to handle people with hip replacements, knee replacements, and shoulder replacements.
I've never seen a program like it, and I think there's been a lot of other hospitals that have come here to try and duplicate that, and they're having a rough go of it. It's small enough that we can really control it. It's not too big. We do upwards of 8 total joints every Monday, and it's the same nurses that started at 12 years. It's the same physical therapists. It's they really specialize and cater to the joint replacement patients.
Volume and experience with appropriate attention to detail breeds excellence. And that's what the Joint Academy is about, having a reproducible result time and time again.
The biggest advance that we've seen has been the anterior approach in the hip replacements. As far as the shoulder goes, there's a newer technique out there called a reverse total shoulder replacement that has been performed here in Shelby for probably the last 2 years, maybe.
Probably more than that.
Maybe more than that. It's just a completely different shoulder replacement than what we've done in the past. We still do the standard shoulder replacements, which are for shoulders that don't have massive rotator cuff repairs or irreparable rotator cuff repairs. This reverse shoulder basically has filled a problem area for shoulder replacements.
If someone's looking for a place to get their shoulder replaced, the first thing, of course, is surgeon selection. You want to make sure that your surgeon has done many of these. Also, I think going to a place that has certification as a center of excellence by an independent commission like JCAHO tells the patient that the process has been evaluated and deemed excellent from top to bottom. That means you're getting the right therapy, you're getting the right medicine, the nurses know what this is and what is expected, so it's not something that they're having to reinvent on the spot.
We try to stay on top of the technology as it comes out. Sometimes we find that it really does improve quality. Sometimes we find it's just another tool that doesn't really change the result. And so we try to stick with the things that do the best without adding a whole lot to the cost or time or really maybe unnecessary for what we do on a daily basis.
The great thing about Cleveland Regional, even though it's a regional hospital and not in a giant metropolitan area, we're able to do superb work here. I feel like the quality of the work is as good as you get anywhere in the state. And JCAHO apparently feels the same way because they gave us the designation.
For your primary joint replacements, we have it probably overly covered. But there are those revisions that are extremely difficult or extremely complex that we still refer down to Charlotte to a few of the sister hospitals down there.
Some of the complex revisions really require a larger facility to be able to manage, partly just because of the number of different parts you have to have available at the time you get into this operating room. Some things you just can't predict ahead of time, and we're not a big enough facility to have all of those things on the shelf ready to go when necessary. But certainly the predictable things we're more than comfortable handling here in Shelby.
We do what we do well, and what we don't do well or can be done better elsewhere, we send out. I mean, of course, there are areas in orthopedics that can't be done here regionally, and I think we all have the patient's interest at heart. But a lot of what we do well, and there's really no reason that I can think of for a patient to go elsewhere for a hip replacement, a knee replacement, or a shoulder replacement.
You'd be surprised how many patients have had an experience at another hospital in the area thinking they needed to be in the big city for surgery. They come back here to be closer to home, closer to family for the second time around, and they're pleasantly surprised with how much better things seem to go here compared to there.